morning, afternoon, and evening, everyone. Thank you for attending our panel discussion today, Getting to Sustainability, Launching the Blueprint for More Sustainable Social and Behavior Change Systems. We're excited to finally share the SBC Blueprint with this group. We have an incredible lineup of panelists who were engaged in the development of the SBC Blueprint. And today we'll share how the SBC Blueprint speaks to their experience and hopes for more sustainable SBC systems in the future. Before we start the panel discussion today, we're going to play a short video introducing the SBC Blueprint. Rose, can you play the video, please?
Social and Behavior Change, SBC. SBC interventions have helped
Oh, it was working, Rose, and then just
to save millions of lives globally, but challenges such as emerging diseases, conflict, poverty, climate change, and other inequities pose a threat to our progress. But SBC capacity and system strengthening alongside other programming can help countries effectively respond to these challenges. Investments to date, however, have mostly focused on individual capacity strengthening needs instead of the systems that govern SBC programming. This isn't helping countries or communities in the long term in tackling these big issues. We knew we couldn't tackle this mammoth challenge alone, so we set out to spark a global conversation. And guess what? You joined in. Together we've crafted a new vision, a blueprint for more sustainable SBC systems. The SBC Blueprint is a guide for governments, donors, SBC implementers, researchers, and others to understand and strengthen SBC systems at the country level. Our goal: sustainable, country-led SBC systems where communities are empowered to embrace healthy behaviors and positive change. What can you do to join in the movement towards greater SBC sustainability? Visit or email us to be part of the conversation and the solution.
Thank you, Rose. I hope everyone enjoyed the video and is excited to learn more about the SBC Blueprint. Before I introduce the panelists, please note that we have a poll question on the slide. We will be using Mentimeter today in this session, so please use the code on the slide or the QR code to let us know where you're coming from today. Where are you sitting? We suggest you keep the Mentimeter open as we will be asking a series of questions today, and the link will provide you access to these questions and move you automatically through them. My name is Emily Bach, and I'm honored to be your facilitator for today's discussion. I'm a senior technical advisor with our SBC division at FHI 360, focusing on capacity and institutional strengthening for SBC. Our panelists today are Kara Tereski, a seasoned leader in SBC with nearly 25 years of global health experience and is the director of the SBC division at FHI 360. Delilah Takawera has vast experience in SBC program design, research, implementation, and monitoring, and working with stakeholders across sectors. She is a technical advisor for the SBC project and Tukunda project in Zimbabwe. Our next presenter, Nicola Christofides, co-led the development of the inaugural African-based postgraduate training for SBCC in 2009. She at the University of Witwatersrand's School of Public Health, where she is an associate professor. Amelia Anusin is a seasoned specialist with a background in development communication, social marketing, and media. Amelia currently serves as the media development and private sector engagement specialist on USAID Ghana's Accelerating Social and Behavior Change activity. Dr. Richard Kambanda is a public health specialist leading Uganda's health promotion and disease prevention efforts as head of the Department of Health Promotion, Education, and Health Communication at the Ministry of Health. And last but not least, Ms. Ladidi Bako-Ayagbusi is a public health practitioner and a career civil servant. She is the director and head of the nutrition department at the Federal Ministry of Health and Social Welfare in Nigeria. And previously, she was the head of the health promotion department. Next slide. Before we dive into today's session, I wanted to give you a quick overview of what we will be covering. Many of you might already be familiar with the development of the SBC blueprint, and some of you have even contributed to its creation and review. But to make sure everyone is on the same page, I'll provide a brief introduction to the SBC blueprint. Afterwards, our initial group of panelists will discuss why the SBC blueprint, sharing our vision for it and emphasizing the need to look at things through a systems lens and strengthen our connections with sectors outside of health. After they share their insights, we'll have some time for questions. Please type your questions into the Q&A section of Zoom, and we'll try to answer as many as possible during the session. But for those we can't answer live, we'll respond to them in the Q&A section afterwards. Next, the second group of panelists will talk about how the SBC blueprint can support effective capacity and institutional strengthening. And finally, the last set of panelists will share their hopes for applying the SBC blueprint, moving it from theory to practice in the countries we work in. We'll wrap up the panel with a preview of the next steps and hopefully inspire all of you to join us and continue working with it to advance the SBC blueprint. Now let's review the blueprint before we have our panelists speak. Next slide, Rose. The SBC blueprint is made for those who lead, fund, or support SBC initiatives at the country level. This document is a framework for countries and local actors to use their insights and specialized knowledge to discuss, analyze, and develop country-specific SBC blueprints. To help with this, the document provides guidance and tools, case examples for inspiration, minimum benchmarks, and planning tools. We hope this document and the accompanying tools will support global and national priority setting for SBC and system strengthening, and also be used as an advocacy tool to promote increased SBC prioritization and investments in capacity institutional strengthening. Next slide, please. The primary objectives of the SBC blueprint are to challenge the global SBC field to think critically about the systems that govern SBC initiatives, aiming for greater quality, impact, and sustainability. To create a shared vision for sustainability within the field that adopts a more holistic approach to SBC. To advocate for more increased resource allocation, prioritization, and investment in SBC systems. And to propose a foundation to guide the achievement of these objectives I just mentioned, fostering dialogue to realize institutional and technical capacity improvements. Next slide, please. Over the past year and a half, we hopefully have led an engaging process to develop the SBC blueprint. First and foremost, I want to thank the SBC community and everyone here that was involved in the listening sessions, online polls, and in-person events. Your input has been invaluable. In addition to everyone who contributed to developing the SBC blueprint, I want to extend my gratitude to the technical reviewers, including global SBC implementers, donors, and other SBC actors. And a special thank you goes to the guiding committee who have been with us from the start. They facilitated and engaged discussions and informed and developed components of this SBC blueprint that we're sharing with you. The guiding committee includes representatives from the African Society for Social and Behavior Change, our hosts today, the Nigeria Health Promotion Division of the Federal Ministry of Health, University of Witwatersrand School of Public Health, and FHI 360. Many of the guiding committee members are on the panel today, but for those who aren't, I would like to give a special acknowledgement to these members. Kenneth Malundo from ASSBC, Ms. Chinyere Ogbonna from the Nigeria Health Promotion Department, Desda Kebede from FHI 360 Ethiopia, and Rose Wilder from FHI 360. Thank you to everyone who has contributed to the SBC blueprint and supported us to get to where we are today. Next slide, please. As mentioned today, we're excited to share this SBC blueprint with you. To provide an overview of the document itself, the SBC blueprint is divided into 4 sections. The first section looks ahead at the future and our hopes for a more sustainable SBC system. It sets out a vision and introduces a new theory of change to achieve this. This part of the SBC blueprint is about mapping out the future. We start with the future so that we can imagine possibilities beyond the constraints of our current situation. Once we've developed our vision, we take a step back and look at the present SBC system that we work in, the actors involved, how SBC systems can be set up, their structures, and connections with other sectors. This helps us be practical and thoughtful about where we are now. Once we know where we are, the present, the third section of the SBC blueprint focuses on how we can advance and strengthen our system to achieve the vision we set forth in the future. The section supports the review of attributes and functions of a sustainable SBC system and competencies needed to support it. The section ensures that every step we take and plan is purposeful and aligned with our vision. The final section of the SBC blueprint covers the monitoring, evaluation, research, and learning needs for sustainable SBC systems. The section includes some illustrative SBC system strengthening indicators and sets out some learning agenda questions. Each section of the SBC blueprint comes with an accompanying tools, which we'll discuss later in today's session. Next slide, please. So why the SBC blueprint? As mentioned in the video, SBC interventions have significantly contributed to lowering global maternal and child mortality rates and fighting infectious diseases and other health challenges. However, there's still a lot more that we can do. The blueprint stemmed from a dialogue on where we asked what is working, what is not working, and what would it take for an SBC system to be strong and self-sustaining. Our first speaker, Kara Tereski, will share what we heard in our engagement and how we've responded to it in the SBC blueprint. As she is speaking, please think about the question, what challenges do you think the SBC blueprint can address in your SBC system? And answer it in the Mentimeter. Kara, over to you.
Thanks
Next
so much,
slide.
Emily. Can you hear me? I'm assuming
yes, we can hear you.
All right, excellent. It's great to be here with everyone today. I really appreciate the introduction and the opportunity to share more about the blueprint. So we're here to discuss a topic that's of importance to all of us. As a field, as Emily said, we really need to think critically about how we strengthen our approaches to address persistent health challenges that are so common across much of our SBC work. And we need to better support countries through strengthened health systems that are strong and resilient and that are able to address new and emerging challenges. And the reason why this is so important is that SBC is often neglected as part of health system strengthening efforts, where we believe it is a critical component of the health system that needs to be amplified to meet the challenges of today and tomorrow. There is an opportunity for all of us to elevate the importance of SBC in line with health system strengthening and the global focus right now that is being placed on strengthening primary healthcare systems. So we believe this is a critical time to act. As part of our SBC blueprint engagement processes that Emily mentioned, we really wanted to understand the challenges that countries faced in sustaining the delivery of SBC programs and towards country ownership and leadership of SBC, and to brainstorm with the SBC community, many of you all today on the line, ways to address these through capacity and system strengthening approaches. So in these conversations, several key themes emerge, and I think they'll be familiar to many of you. Time and time again, we heard from the SBC community that there's an overemphasis really at country level on health promotion or communication-only approaches, rather than the use of more holistic SBC strategies that can address the complex needs that we're tackling. But there's too heavy an emphasis on individual level drivers of change rather than social and structural determinants. Inadequate community engagement and integration of behavioral insights and evidence into SBC programs and policy. And that there's still a lack of effective coordination and collaboration among both health sector actors as well as across sectors. And there's an overall underappreciation and continued inadequate funding for SBC relative to other health sector investments. We also heard the community's frustration that despite these significant investments in SBC capacity strengthening to date, many SBC technical and organizational capacities still remain uneven. So to address these challenges, we really believe that we need a systems-based approach, one that takes into consideration planning, budgeting, financing of SBC programs, technical and management competencies, policy advocacy, as well as an approach that advances a more holistic SBC strategy, moving from health promotion to a broader, wider lens for SBC. and in doing so, engaging a wider set of actors, including those outside of the health sector, and using a range of different SBC programming strategies. So with this all in mind, we developed the SBC Blueprint. Our hope today is that the Blueprint can guide SBC professionals in designing more robust capacity and system strengthening strategies that enable quality SBC programming to be sustained at country level over time. So ultimately, our vision, as you can see on the screen in launching the Blueprint today, is for sustainable country-led SBC systems that can oversee the design, implementation, and evaluation of SBC initiatives that have the ability to empower individuals, families, and communities to adopt and maintain healthy behaviors while also driving positive social change and development. Next slide, Rose.
Can I just interrupt real quick? I'm sorry, the interpreters are having a hard time keeping up with you. Can you please slow down your pace some?
Sure.
Thank you.
Sorry, I'm a fast talker. So for the Blueprint, we defined the SBC system to be comprised of a network of actors, including government, civil society, the private sector, academics, individuals, and communities that all work together to promote healthy behaviors and improved health outcomes. We're defining sustainable systems as those that are resilient, adaptive, self-sustaining in terms of their structures and their practices, and that are able to deliver impactful quality SBC programs that meet communities' needs. Towards achieving this for SBC, we've defined 3 key pillars that the Blueprint hopes to help country actors focus on and strengthen. These include SBC technical capacities, government, civil society, and community level structures for social and behavior change, and collaboration and shared programming objectives among health and other actors that are necessary to address those factors that we talked about at individual, social, and structural level. So by focusing on capacity and system strengthening activities for SBC on these 3 pillars, we think we can address some of the technical and systemic challenges that I just discussed that came out of the listening sessions. We can go to the next slide, please. And so the Blueprint proposes a framework or a theory of change for SBC capacity and system strengthening to achieve outcomes related to these pillars. So we've included a list of illustrative outcomes and intermediary outcomes that you can see on the slide and in the document that countries may wish to prioritize, as well as a list of potential activities that could be carried out to achieve these outcomes. So just to give one example, to achieve an objective of strengthened and resource structures for the oversight of SBC programming, SBC system actors at a country level may wish to focus their efforts on trying to ensure dedicated and adequate SBC funding through domestic resource and other resource mobilization strategies, ensuring qualified and sufficient SBC staffing, or strengthening infrastructure systems and policies. So overall, our hope is that governments, donors, SBC practitioners, and other actors will adopt the Blueprint as a first deliberate step towards achieving these outcomes. And in doing so, that this will infuse greater sustainability into the SBC field in ways that are country-owned and led. Thank you. Emily, back to you.
Thank you, Kara. Sorry, I had problems unmuting a little bit. Thank you for sharing just our thought process, what we heard, and how we hope the SBC Blueprint can really address the challenges. If people can see the Mentimeter, I know Rose is dropping images of it in the chat. I think there is agreement and alignment around some of the challenges that we really face, focusing on sustainability, resourcing for SBC, engagement, and inclusion. And also I see a nice transition to our next speaker, Delilah, just the challenge of strengthening our connections and collaboration with outside of the health sector, where SBC has really found its footing, but beyond the health sector, how does SBC support their objectives, but how do their objectives support our own? One of the main tenets of the SBC Blueprint is the need for this increased connection. Our next panelist, Delilah Takawira, will share her thoughts on how the SBC advocates and addresses the need for strengthened, increased intersectoral collaborations. This is something she does every day with her work on the Takunda project. And as with the previous Mentimeter question, we've advanced it to the next one. Please, as Delilah speaks, as an SBC practitioner, think about how would you rate your interaction with non-health actors in your SBC system? Delilah, over to you.
Thank you, Emily. Please confirm you can hear me.
Yes, I can hear you.
Okay. And due to bandwidth, I don't think I'm going to keep my camera on, so please allow me to switch it off so I remain audible. So yes, certainly we can't talk of systems thinking without talking of collaboration. Engaging other sectors in social and behavior change is not only a good thing to do, but essential and for many reasons. So firstly, because behavioral determinants are both multifaceted and interdisciplinary, requiring both systems and SBC actor level changes related to collaboration, planning, financing, and management. Secondly, it helps to ensure demand-side interventions are aligned with supply-side strengthening. And the third reason is that multi-sectoral collaboration also enables more robust SBC strategies that can address the wide range of individual, interpersonal, social, and structural factors that impede or facilitate healthy behaviors. And lastly, engaging other sectors enables sustainable systems and, more importantly, greater sustainability of SBC outcomes that are delivered by the system. Now, as way of example, and as Emily has mentioned, I work in Zimbabwe and I work in a USAID-funded resilience and food security activity called Takunda. And amongst the other things that we're trying to promote is to improve nutrition and health of women and children. And looking at children ages 6 months up to 2 years consuming a diversified diet. Social and behavior change formative research conducted at the start of the project showed that one of the major barriers to children consuming healthy, diversified diets was access to the food itself in households. Now, to be able to achieve our project outcomes, we could not use interpersonal communication or other behavior change promotion methodologies alone without addressing the physical access of food in households. So because of that, we roped in our colleagues in the agriculture sector to provide the necessary food through various activities, promoting climate smart agriculture, establishing community gardens that are irrigated through solar powered boreholes, promoting livestock production, particularly small livestock production. And together with that, we also went in even to develop other food products like an enriched flour blend. And we even went on to partner with private sector to scale up production, marketing, and to ensure sustainability of household access to the food that children need to eat to be healthy and to be well nourished. In fact, speaking of the private sector engagement, you can join us in a panel discussion tomorrow, starting at 6:25 East African time to learn more about that. Now, to strengthen connectedness across sectors, the SBC blueprint recommends a number of ways. And the first one is strengthening policy frameworks. Policy frameworks that emphasize intra and intersectoral collaboration, clearly defining roles, responsibilities, and coordination mechanisms among pertinent sectors help to ensure strategic allocation of resources for social and behavior change. A second way is establishing intra and intersectoral committees or task forces. These help to serve as spaces for sharing best practices, resolving conflicts, and strategy alignment. I know, for example, in Zimbabwe, we do have what are called multi-sectoral food and nutrition security committees. Those can actually serve as platforms where social and behavior change can be integrated. A third way is promoting shared funding mechanisms, such as equity funds, which foster coordinated efforts among health units and sectors to achieve risk pooling objectives. Institutionalizing pooling enhances cost effectiveness by reducing duplications and fragmentation. Another way is encouraging knowledge exchange and capacity strengthening. These knowledge exchange platforms or training programs and workshops that bring people together, professionals from diverse health units and sectors, can help to enhance understanding and strengthen capacity for collaborative approaches. This allows for the exchange of expertise, lessons learned, and best practices. Another way is contributing to shared indicators. So shared indicators for priority areas can help align goals across units or actors, facilitate communication and shared action, improve accountability, and increase impacts. And finally, engaging civil society and communities. So actively involving civil society organizations, community representatives, community platforms, and other stakeholders fosters grassroots participation and ensures that interventions are community driven. Thanks, Emily, and back to you.
Thank you, Delilah, for your thoughts. And it's if people can see the Mentimeter, Rose has dropped a image of it in the chat, that our how overall we rate our collaborations outside of the health sector as good, not the best, but if we look at this scale, a lot are below the average of 6, but some are above. So hopefully we have hopes that the SBC blueprint can make the next time we ask this question maybe a little higher. But also, I'll put my video on, apologies. But also we'll talk a little bit later about some tools that a tool that we have that can support to really diagnose and think about our interactions and collaborations outside of the health sector. And you'll see a preview of it in the screen that is on the slide right now. I know we're running a little bit behind, but I do want to ask one question to the panelists. And Kara, this is something that a question for you. You mentioned that the SBC blueprint provides a new theory of change. Can you just briefly talk about how this is different from how we usually view SBC capacity institutional strengthening and our SBC initiatives overall? How is it new and how is it different?
Sure. Thanks so much, Emily. So as you said, the theory of change that we put forward in this document is really a specific theory of change for capacity and system strengthening, with the ultimate goal of achieving sustained, resilient, and adaptive systems that can deliver those high quality, high impact SBC interventions that we all hope to deliver within our work. The blueprint provides illustrative benchmarks and indicators in the guide that can be used by countries to measure their progress in achieving this goal, aligned with that theory of change. And so I think this is that's something a little bit different in terms of integrating the M&E aspect and the ability to measure improvements over time. The approach that we're taking builds upon significant other previous investments in SBC capacity strengthening and really doesn't seek to duplicate all of the great resources and tools that are out there already in terms of technical skills building and other areas, but really to fill gaps and get us to start thinking critically about the systems and the 3 pillars that I talked about in my presentation. And so I think it really builds upon those previous investments, but where it differs is that it systematically outlines pathways to strengthen not only the technical capacities, but places much greater emphasis on the structures that govern SBC. And again, the emphasis that Delilah just talked about on how SBC actors engage not only with other health sector actors, but non-health sector actors to move from what traditionally has been a more health promotion focused lens to a broader social and behavior change viewpoint. And then lastly, the SBC blueprint places greater emphasis on SBC financing and professionalization and uses a local systems lens, really recognizing that not every actor in the system needs to perform the same function. But together, all of the functions required for the system to operate effectively for SBC need to be accounted for and performing well together. And one of our other panelists will talk about some of the functions of the system later. So I'll end there. Thank you.
Thanks, Kara. I think that answers the questions that we had in the Q&A. If we haven't answered, we will go through and type in answers for any that are remaining or that come up. But just for time, we are going to move to the next section, which is around supporting effective capacity institutional strengthening. Now that we know a bit more about why the blueprint and what we envision for the SBC blueprint, one thing that really stood out from our listening sessions and our dialogues and our discussions that we've had over the past year and a half is the need for more effective capacity institutional strengthening. As Kara mentioned, the SBC blueprint builds on and operationalizes decades of investments to strengthen SBC system and capacity. And despite this, often capacity strengthening initiatives are really fragmented and don't have the impact that we hope for. In the recent years, we've taken a broader system strengthening lens to address capacity and system level needs for SBC. And as Kara mentioned and Delilah mentioned, we really look to integrate SBC incorporate a systems perspective into SBC capacity strengthening within health and also beyond health. I would like to now hand it over to Nicola Christophides to share with us her thoughts on how the SBC blueprint can support capacity strengthening for SBC and what existing gaps can be strengthened and how. Nicola?
Great. Thanks, Emily. And I'm very happy to be joining from Johannesburg in South Africa. So those of us who have joined the summit are SBC leaders, managers, and implementers who are working in government or in civil society, and we all have diverse backgrounds. Some of us are trained as clinicians or in public and environmental health or health promotion, while others come from the social sciences, including social work, psychology, and many others, or have backgrounds in humanities, such as theatre, journalism, media, and communication. And each of these backgrounds brings many strengths to our SBC system. But there may also be particular capacity gaps that exist within institutions in areas such as budgeting or monitoring and evaluation or translating evidence into programming. So the blueprint outlines the attributes and functions of successful systems and has tools to assist governments and civil society to assess what strengths exist in terms of capacity and where the gaps are. And some of these tools include a tool that looks at the attributes and functions of the SBC system. And attributes in this context are defined as characteristics or qualities that describe the nature, culture, and capabilities of the system. And it's possible for a country to be on a continuum from a nascent, from having being nascent in these attributes or having these attributes be fully present within their system. Functions in the context of the blueprint include specific activities, tasks, or roles that are carried out within SBC systems to achieve its objectives. And there are some easy-to-use tools that accompany the blueprint, which allow institutions, organizations to collectively assess their organizational capacity and also where the gaps are. So it takes users through a prioritization process to decide on what actions need to be taken to address capacity gaps. The organizational capacity assessments can also form a baseline and allow for the monitoring of progress for the institution. So the institution can set its targets and then see the extent to which capacity is being strengthened. So I'm going to hand back to Emily now. Thanks.
Thank you, Nicola. I think from I agree with you. From the participants on this conference today, it's evident that SBC professionals coming from a diverse training and educational background have many different roles in the SBC system. Even yesterday, a presenter at the pre-summit event spoke to the work that University of Wits and FHI have done under Sea Change, Malawi, HC4L, and other projects to really support the professionalization and professionalization of SBC for the diverse group of SBC professionals we have here today. And it's excited for me, and I hope others, to explore how the SBC blueprint can continue to build on this work and really move this field forward. To dive a little deeper into what a systematic SBC capacity strengthening initiative can look like within the government sector, Amelia Newson is going to share with us how USAID Ghana's Accelerating Social and Behavior Change activity is supporting the systematic capacity strengthening within the Health Promotion Department. Amelia, over to you.
Thank you, Emily. And since it's such a mouthful for a lot of people, I'll be calling the Accelerating Social and Behavior Change Program ASBC for short, for now. So in Ghana, in the implementation of this project, we have been working with the Ghana Health Service Health Promotion Division. And one of our key resource areas is to support the systematic approach to capacity strengthening for SBC and health professionals. We've been doing this in 3 ways. I'd like to spotlight 3. There's a lot more, but I'll be talking briefly about one of which is the training programs that we've been organizing. Now, the 2 of them, which is the Change Agents Development Program and Set for Change, are cornerstone training initiatives that are designed to empower HPD staff. For now, it is a 1-week-long residential program where they're given capacity building on everything from social and behavior change programming, including SBC in initiatives, communications, and a host of other topical areas. And the curriculum is thorough and well thought out, and it's co-created with the Health Promotion Division so that they understand the need to include SBC in their programming and how to actually go about it. Now we are working to digitalize these training programs so that they are available to even more health promotion officers within the Ghana Health Service. And this is one way that we are able to also sustain SBC system strengthening within the Health Promotion Division. I'll also like to highlight another level of what we're doing, which is also to support the sustainability efforts. The health promotion officers that excel during the training move on through further training to become trainer of trainers and master trainers. And so they then in turn become SBC champions that within their districts, within their regions, organize trainings, take opportunities within team meetings, and when they go out, even into the field, to champion SBC and to encourage others to include it into the programming, and also to give them practical tools and steps that they can use to embed SBC within all of the health practices that they do. And then finally, for those who go even further and excel even more, the Health Promotion Division incentivizes them through what we call the Change Challenge Fund. And this comes both in financial support and recognition, and they are giving the support that they need to implement SBC initiatives within their communities. And we have seen health promotion officers implement programs with adolescent corners, go out into the communities to launch health campaigns, to do community debates. And we're seeing remarkable results in improving overall health and what we call good life. That's the overall overarching campaign that the Ghana Health Service champions. And so these are some of the ways that the SBC Blueprint serves as a comprehensive roadmap that outlines the various actors involved in sustaining SBC and also provides practical tools and strategies for engaging them. So that's a little example from Ghana that I'm excited to share. Thank you. Over to you, Emily.
Thank you, Amelia, for sharing some really exciting work that your activity is doing with Ghana's Health Promotion Department. I know from speaking with you and working with the team that it's really focusing heavily on sustainability and transitioning from HPD co-implementing with the activity to them leading the capacity strengthening initiatives on their own. We did initially have a little time for questions, but I want to make sure that we have sufficient time for the next set of panelist speakers. So please type your questions in the on Zoom, and we will answer as many as we can, but we will have time at the end for overall questions. So hopefully we will get to them. Next slide, Rose. So we have heard a lot about what the SBC Blueprint is and our hopes for it. Now let's shift the focus a little bit to think about how we can use the SBC Blueprint in our work. It's our hope that governments, SBC practitioners, and donors will use it to guide country-level efforts to strengthen their own SBC system. And as mentioned earlier, we have a set of tools to support users to go through the 5-step process to imagine, design, validate, implement, monitor, and a country-level SBC blueprint, which will, next slide, please. So to operationalize, as you'll see, we have a 5-step process that we previously mentioned, but to operationalize this, we've created an initial suite of tools for an SBC blueprint development. Each tool helps build a country's SBC blueprint, which is a plan to sustain its own SBC system. This plan includes a vision, a map of the SBC system, an assessment of what we want the system to achieve, and an implementation and monitoring plan. The 5-step process focuses on putting system strengthening plan into action and adapting as needed. Step 5 focuses on putting the system strengthening plan into action and adapting as needed to make sure we're on track. We aim to keep adding new tools to the SBC blueprint over time, but this is the initial suite of tools that we think will be needed. Next slide. I would now like to ask Ms. Ladi Bako-Ayagbusi to speak to how the SBC blueprint supports Nigeria's priorities and needs, and if she has some thoughts on how to operationalize it in Nigeria. As before, as Ms. Bako-Ayagbusi is sharing her thoughts, please consider the Mentimeter poll question. How would you start the SBC blueprint in your country? Ms. Bako-Ayagbusi, over to you.
Thank you, Emily. From Nigeria, good afternoon, everyone. Social and behavior change interventions have been used to address key priorities and needs in line with Nigerian development goals and policy framework, such as the National Strategic Health Development Plan, the Economic Recovery and Growth Plan, the Sustainable Development Goals. In 2006, there was a paradigm shift from health education to health promotion with the development and the launch of the National Health Promotion Policy. And thereafter, health promotion was institutionalized at the national and also at the subnational level. The institutionalization and the existence of health promotion officers at the national and subnational level created an avenue to design and implement social and behavior change intervention to address key priorities and needs in Nigeria. Specifically, in Nigeria, the SBC initiatives align with priority areas such as health, education, gender equality, economic development, security, to mention but a few. Looking at the impact of SBC initiative in improving health. In Nigeria, while responding to epidemics or outbreaks, such as when we had the Ebola or the COVID, SBC campaigns were vital for promoting preventive measures, for promoting vaccine uptake, and also to ensure adherence to public health guidelines. In Nigeria, there is high rate of maternal and child mortality. SBC campaign is being used to improve health by promoting practices such as the antenatal care, immunization, breastfeeding, uptake of family planning services, self-care practices, which are also very crucial to improving health outcomes. Likewise, SBC initiative focus on prevention of communicable and non-communicable diseases through awareness campaign and the promotion of the use of bed nets to prevent malaria, safe sexual practices to prevent HIV, and the adherence to medication when on treatment, such as tuberculosis. Now, looking at education, the SBC initiative is being used by the Nigerian government to prioritize increasing school enrollment and reducing dropout rates, especially among girls. The strategies that are being used, the SBC that are being used, it encourages community to value education and support children, particularly girls, in staying in school. SBC is also being used to promote positive behavior among teachers, parents, and students, thereby enhancing learning environments and outcomes. Likewise, in the Nigerian government prioritizes gender equality and women empowerment, and SBC program is used to change societal norms and behaviors that perpetuate gender-based violence and discrimination. Likewise, SBC initiatives encourage equitable access to resources and opportunities for women and girls. We also use SBC to foster environments where girls can thrive and contribute to economic and social development. Another priority area for Nigeria is economic development, where SBC initiative is used to support skill development and entrepreneurial behaviors that drive economic growth, particularly in underserved communities. And SBC initiatives, it's also being used to promote responsible financial behaviors among Nigerians through promoting better economic stability and growth. SBC initiative is also used to promote practices that help communities to adapt to climate change, such as sustainable agriculture and resource management. And the SBC initiatives are used to foster community cohesion and conflict resolution through dialogue and understanding, particularly in areas affected by ethnic and religious tensions. Initiative that we also use SBC initiative in Nigeria to address underlying social, economic, and political grievances. So by addressing these prioritized areas, SBC initiative in Nigeria is being used to ensure that behavior change interventions are relevant and effective in meeting the country's specific needs and priorities. Thank you, Emily, and over.
Thank you, Ms. Bako Ayagbusi. It was great to hear how the Nigeria Health Promotion Department is really taking a systems lens to ensure that SBC initiatives at the national and subnational levels are aligned with the priorities in health and other sectors. So I think that speaks very well to the SBC blueprint. And we hope that the SBC blueprint can further strengthen HPD's efforts in this. I would like to hand it over to our last panelist, Dr. Kabanda. Could you please share your own thoughts around the same questions, but from the Uganda perspective? Over to you, Dr. Kabanda.
Thank you. Good evening and good morning to everyone. I think most of the technical aspects have been articulated. And from the Ugandan perspective, I think what is critical and what the SBC blueprint brings on the table is how best can governments or countries be able to transition from theory to practice. Many documents usually are written in a more academic manner, and I think this gives us an opportunity to be able to look at some of the practical insights. And that also will really enable us as a country to be able to pick some of the practical insights and how best we can be able to guide local governments and other actors at a lower level through development of guidelines that can be used. So literally, the blueprint will serve as a guide as we update our SBC guidelines, more so within the area of community engagement. So I think as a first point, that is something that is very, very critical. There are other 3-4 critical areas of concern, which I think that I should be able to share with you as a country. When you look at the details of the SBC blueprint, it gives us insights on how best we can do SBC programming in a country, highlighting 3 critical components within the programming component. One is the multi-sectoral component beyond medicalization, because many times ministries of health tend to take lead, forgetting the many more other actors. And I think sometimes governments, particularly our government in Uganda, we tend to look more at other non-government actors at a time when there are projects that are running. And we tend to forget working closely with other actors who may be well schooled within the area of SBC, with experience and practical insights on how we may need to do SBC programming in a country. The other component that has been well articulated, which I think that will also be so much prioritized, is the component of community-led programming, which is very, very critical. Usually at national level, we tend to think that we know each and everything, forgetting that at community level, there is a way how people need SBC to be structured. I think that is something that would also be much more put forward. The other critical component which we should also be able to speak about is the component of sustainability. Most of the SBC programming and implementation in many countries, of course, speaking about the Ugandan context, is 70% or even more is financed with partner support. And I think the component of sustainability here is very critical. Us in government being able to realize that fronting the disease prevention aspects across on board requires government to make investments, starting with humble beginnings. So I think that is something that we also need to think through. But this also cuts across to many countries that SBC is not really well funded by governments. So the discussions on sustainability require governments to put resources, but of course also to invest in human resource to ensure that there are enough positions for managers and those who are involved into implementation. And I think borrowing a leaf from the SBC blueprint, that is something that we are going to advance. The other critical component is in line with the capacity building. Building the capacity of our human resources is very, very critical. And I think this will also serve as a guide in trying to identify what are the critical practical components as a country may need to prioritize as we build the capacity of our practitioners. And lastly, is the component of monitoring and evaluation. We know that for quite a long time, evaluating the impact of social and behavior change has been challenging. And I think the blueprint gives us insights on what areas to look out for as we engage, work with partners, work with local governments, work with the private sector to be able to put forward critical components that require monitoring and evaluation to enable other actors within the health sector and other sectors, whether it's agriculture, water and the environment, to be able to appreciate the relevance of investments in this area, but of course also how best you can be able to demonstrate that SBC really works. Over.
Thank you, Dr. Kabanda. It was great to hear about your critical considerations for Uganda. And as you also mentioned, I think a lot of the components you mentioned, being multi-sectoral, community-led, resourcing for SBC, and especially monitoring evaluation speaks to many of us on this panel today. So we had hoped there'd be some more time for questions, but we are running a little bit long. So please put questions in the chat. We will answer as many as we can, and we will provide some context at the end of this presentation for how you can continue to reach out with us. And we have a special request. For those who are at the summit watch parties, I see there are quite a few in the chat. It would be great if you could take some time to discuss among yourselves how you think as a group, perhaps through the ASSBC country chapters, you might want to take on the SBC blueprint. What would your first steps be? What would it look like? What would it require? Just start a conversation around it for those who haven't already. I do want to, before I close out the panel discussion about what's next, ask any of the panelists, are there any last minute thoughts, any last minute things they want to share with the group before we move to close, to conclude this discussion?
Emily, just maybe
Yes.
If you could talk, and maybe this is part of the closing, but if you could talk a little bit about the tools and sort of what the vision is for the future, because I think this is a start at this point. We've set out a vision collectively and a framework to try to strengthen our approaches to capacity and system strengthening in our field, but we don't have all the answers quite yet.
Yes.
And some of the tools are just a start, and we hope to continue to evolve them over time. So I think you're going to speak about that a little bit, hopefully, as we close.
That's a nice lead into what is next. As we've talked, as Karen mentioned, that this is not the end of the SBC blueprint, and also from hearing from me and others on this panel, we don't want this to be a document that's disseminated and forgotten. Instead, it is our greatest hope and wish that it will be used, adapted, and taken on by others. So our next steps are really about operationalizing the SBC blueprint through the tools. So in August, we are planning a series of online sessions that will focus on this. We will explore what is needed to prepare and engage for stakeholders for the SBC blueprint, which I saw in the Mentimeter, a lot of needs around this, about how to understand the blueprint, how to share it with others, how to really get champions for this blueprint, just kind of the pre-engagement in the background stuff that needs to happen. And also we want to do a deeper dive into the initial suite of tools. As Kara mentioned, this is just the first set. We hope and wish that we have more planned, but just really taking a look at what we have, just asking questions and seeing how they can be adapted for the context and for anyone that is interested. And also, as we mentioned, we want everyone here and other SBC practitioners to use the blueprint and continue to engage with us. If you want to implement, test, or use the SBC blueprint, let us know. If you want to share tools with us, additional tools with us, or support the development of more, just let us know. And if you want to be involved in any way in advancing the blueprint, as you can guess, just please let us know. Engaging with the SBC community over the past year and a half has greatly impacted and shaped the SBC blueprint, and we really want this continue because we truly believe this has been invaluable and has only made it the product it is today. The last question on the Mentimeter is, if you haven't shared with us already, please share with us your contact information if you want to continue being engaged. Next slide. Lastly, several of you asked where you can find the SBC blueprint and the tools. Here they are on this slide. Rose will drop them in the chat too. But in addition, please filter email me or anyone out or SBC at FHI 360 with any questions you may have. I want to thank all the panelists today. It was an honor to be part of this panel and hearing the amazing perspectives, experiences, and hopes for the SBC blueprint. I hope everyone on this summit or this conference feels the same way I do, and we are grateful that you have chosen to spend time with us so that we could share this blueprint with you. Thank you, everyone, and back to ASSBC for the next session. Thank you very much.